My name is Victoria Benavides, and the focus of this presentation will be on the effects of air pollution exposure in low socioeconomic status communities. Environmental health is a sector of health disparities that has been receiving an increasing amount of attention. Environmental factors are not outside the realm of health disparities, and air pollution is a primary example of a prevalent health disparity. There is a growing body of research that informs how we can best serve populations that are unequally exposed to harmful toxins and particles in the air. The health effects of fine particle pollution are well documented. Studies worldwide have shown that on days when fine particle concentrations increase in a community, more people die from heart attacks and respiratory problems. For example, sulfate triggers asthma attacks, vanadium irritates the lungs, and nitrate causes heart attacks or strokes. Individuals of low socioeconomic status are in particular danger of air pollution due to a number of factors. Low SES position has been most consistently associated with greater harm for air pollution, more consistently than race or ethnic groups. People of low SES often have occupations that contain more exposures to harmful air quality, live in neighborhoods close to busy highways with concentrated exhaust fumes, and are all around more susceptible to health risks due to lesser quality health care. This map depicts an example of a predisposing characteristic for these low SES populations, which is geographical location. Most of these urban clusters have the highest emissions of air pollution. The wealthy are able to afford housing in suburbs further from polluted areas, while the individuals of lower SES are clustered in urban areas and are at higher risk to exposure of air pollutants. The majority of low SES populations are supported by Medicaid, but there is still a large portion of this population that are not supported by insurance. This puts them at an even higher risk for mortality as they are being affected by harmful pollutants and cannot receive the necessary health care. The air pollution in these low SES communities has caused a variety of health problems. Studies have discovered a link between outdoor air pollution and cognitive functioning among older adults. This may be in part due to stress, another factor experienced more prevalently in individuals of low SES. Psychosocial stress is an important factor in determining susceptibility to environmental hazards in older populations, and they may be particularly affected by exposure to hazardous air quality. Harmful pollutants such as NO2 from traffic emissions are linked to asthma and lowered lung functioning in children, as well as low birth weight and heart disease. Collected data has revealed that NO2 concentrations are highest in low SES communities. This early life exposure to fine particulate matter and industrial pollutants are also positively associated with childhood asthma diagnoses. Houston is home to one of the largest petrochemical complexes, and it contains a quarter of the nation's refining capacity. In this study, tracking cancer risk across Harris County, results indicate that Hispanic residents with social disadvantages were at higher risk of cancer. These risk disparities are especially high along the corridor flanking the CHIP channel, an area of high-risk neighborhoods where residents are most exposed to hazardous air pollutants. Due to their low SES, these residents are more susceptible to cancer and other hazardous diseases. This map pictures the levels of mean particulate matter throughout the country. Fine particulate pollution typically contains a mixture of particles including soot, acid, condensates, and sulfate and nitrate particles. Fine particles are thought to pose a particularly great risk to health because they are more likely to be toxic than larger particles and can be breathed more deeply into the lungs. A 2016 study of New Jersey residents found that the risk of dying early from long-term exposure to particle pollution was higher in communities with larger African American populations, lower home values, and lower medium income. These communities of color and those with low education, high poverty, and unemployment may face a greater risk even if their air quality meets federal health standards. Overall, scientists have determined that there are 3 general reasons why environmental disparities exist. First, racial divides are a factor in biased housing markets and land costs. Second, low social position means less healthcare, less grocery stores, poorer job opportunities, higher traffic exposure, which are all harmful to health. And finally, existing health conditions play a role. For example, individuals with diabetes are most at risk to air pollution, and African American and Mexican Americans that live closer to urban areas typically have higher rates of diabetes. What policy changes can officials implement that will lower the amount of harmful air pollutants in these low SES communities at both an individual and a system level? What predisposing factors in communities make them more susceptible to environmental health risks?